Hello again, this is Introducing Herbal Medicine, Video 10, Part 1, and this one is about consulting a herbal practitioner. So what is the law regarding practicing herbal medicine in the UK? In fact, it goes back to 1542, an Act of Parliament to protect herbalists from prosecution, which was brought to bear by Henry VIII, who himself was an amateur herbalist. It wasn't until 1968 that the Medicines Act made provision for the prescription and supply of herbal medicine by herbalists according to his judgment as to the needs of a particular person who consults him. In other words, a consultation had to take place. In between 2000 and 2010, there were wide-ranging discussions with the UK government on the regulation of herbal medicine, and a lot of people spend a lot of time on this, but the discussions failed. So still, the practitioners in the UK are operating under the 1542 law of Henry VIII. Herbal practitioner training is at least 3 years and covers the basic sciences, biochemistry, botany, anatomy, physiology, also the phytopharmacology, that's of plants, and the materia medica appropriate to obviously the herbal medicine. Then there's the medical side, nutrition, pathology, diagnosis, clinical examination, and laboratory diagnostics. And then therapeutics, herbal therapeutics, dermatology, psychiatry, geriatrics, ethics, pharmacy, and finally 500 hours of clinical practice. So it's quite a daunting prospect to start training. It needs commitment. So consulting a herbal practitioner, you would expect a length of consultation to be about an hour for a first consultation, maybe 30 minutes for any follow-up consultation. And it's a holistic approach to health, identifying underlying causes of illness such as inflammation or anxiety rather than simply treating just the symptoms. And the therapy will involve diet, nutritional and lifestyle support, advice to continue with orthodox medicine, and this is very important because herbalists are trained to advise on potential herb-drug interactions, and then an individualized herbal prescription. The most common way in which herbs are dispensed by herbalists is actually as liquid medicine. This is normally comprised of a mixture of between 3 to maybe 7 herbal tinctures, which is made up of macerating the dried herb in aqueous alcohol, as you see here in the illustration. And these are individually prescribed for each patient. Occasionally, a herbalist might use tea. Some herbalists are more favour them more than others. These can be a mixture of herbs and again mixed for the individual. Powdered herbs can be used, but these are quite weak in effect. So in modern times, herb extract tablets have been used, which are concentrated forms, which are like the tincture, which is then dried. And then creams and ointments can be supplied for topical use. So in this photograph, this is part of my own clinic dispensary. You see the herbs laid out, in this case, in Latin name order. So typically a practitioner would have perhaps 200 herbs which they use on an everyday basis, and more perhaps used less frequently. And making up a mixture, you would need to measure it. So you would work to 100%, and the formula might be 20% of one herb, 20% of another herb, maybe 30% or 10% of another herb. Obviously, that's written down and recorded for future use. So some of the conditions which can benefit from herbal practitioners, definitely inflammatory conditions like eczema, psoriasis, arthritis, migraine, bronchitis and catarrh, sinusitis, quite difficult to treat conditions, hay fever, colitis, and neuropathy. Hormonal problems, very common that the herbalist gets patients with these. Menopausal problems, PMS, PCOS, polycystic ovarian syndrome, and as the photo shows, fatigue conditions. Long COVID has come along now, but chronic fatigue syndrome, it's a variant of chronic fatigue syndrome. And conditions not responding to modern medicine often end up in a herbalist practice. This could be any inflammatory condition, or indeed any condition that people might think could benefit from herbs. So to summarise, the herbalists in the UK work under the 1542 Act of Parliament introduced by Henry VIII to protect herbalists from prosecution. Herbal practitioners have a 3-year training, including the basics of modern medicine. Consultation with a herbal practitioner involves a detailed case history and advice on diet, lifestyle, and herbal medicine, with particular attention to potential herb-drug interactions. Herbalists may prescribe a mix of tinctures aimed at symptoms and underlying health problems. Common conditions treated by a herbal practitioner include chronic fatigue and hormonal problems, and often problems which are not responsive to modern treatment. So I hope that gives you a little idea of what you might expect. And thank you very much for listening. Thank you.